Okay, the chair would like to call the February 8th, 2024 Health Committee meeting to order. We have all members present, so we have a quorum. Item 2 is a consent agenda. Do I have a motion? Motion by Johnston, second by Hanson. Any discussion? All in favor of the consent agenda? Say aye.
Aye.
Any opposed? Okay, do we have any members of the public?
Madam Chair, we've had no requests this evening.
Thank you. Moving on to departmental matters, and 4A is Tim Wiley, the nursing home administrator.
Hello, everybody. Just a couple things that I would like to highlight on the report is we're looking at year end. We saw that for 2023, we had an increase of 8% in our overall census compared to 2022. We were able to achieve a 4% census above budget. We budgeted for an overall average census of 95, and we were able to reach 99.1. Couldn't find that 9/10 anywhere else in the year. So that was encouraging. When we look at budget management there on page 3, the numbers there were preliminary at the time of me writing my report. So just please take that into consideration. The combined revenue from primary payers, though, that was not preliminary. And for the month of December, it was 30% over budget for that month. Then with the expenses were, I believe we ended, at least at this point, we're at 20% over budget with our expenses, most of which is related to labor. And then the expenses also included some costs that were to be covered by ARPA and HRSA funding, but they still showed up on the expense line. So just to provide some clarification there. Also under budgetary matters, we have the RFQ in process related to a large mechanical infrastructure project that we believe is slated to extend into 2025, 2026 timeframe. So I just wanted to give you an update on that. And then the rest is there before you. If you have any questions, I welcome them.
Questions? Also, you should have received the treasurer's report, and she was not able to be here today, but that's very encouraging also, the treasurer's report.
Good.
Okay, hearing nothing else, thank you. Next is Jason Tabb, Juvenile Detention Superintendent, and you have an item for action. 4B1A is request approval of a contract for counseling services at the McLean County Juvenile Detention Center with Kathy Vogel. Do I have a motion? Motion by Hanson, second by Johnston.
This is a reissue of the contract you had earlier, but it reflects a 3% increase in the hourly wage that she would receive for her services. So it had to be redone.
And how long has she been our counselor's been? 20
I can
some
only
years.
remember one other, and I've been here for 27 years, so 20 plus.
She does a good job. Any other questions or comments from the committee? Okay, we'll be voting on the contract with Kathy Vogel. All in favor? Any opposed? Okay, and that's approved. You have your monthly report.
I do. I'd be happy to answer any questions if anybody has anything.
Any questions from the committee? Okay, thank you.
Thank you.
Next is Cassie Alexander, Advanced Correctional Healthcare, Diane Hughes, Jail Superintendent. We have Diane with us today.
Good evening. Cassie Alexander has resigned, so I'm here in her presence. She did put the report together before she left, so I was glad to see that. So if you have any questions, I'll try and answer them as best I can.
Any questions? Go ahead.
I was really hoping to ask Cassie this, but I think anything that you might be able to either shine a light on or maybe come back next month. We've seen that the MAR program has been in effect for quite a few months now, and I'm just wondering what kind of response that you're seeing and then how that is affecting kind of the overall population.
The individuals that are participating in MAR, I mean, it's a select group, but they're working really closely with new people coming in as well and trying to get people on board to participate in the program that they clearly inmate services sees a need for them to be involved in.
Good, I'm glad to hear that. And then the other thing, if I may, is just looking through the reports, I noticed under the statistics, like we implemented these new procedures, and just so telling, looking at the medical grievances and how they have dropped off over the course of the year. We started with like 16, 28, 39, and now we're at 3, 3, and 2 for the last 3 months of the year. And so I'm really pleased to see that the new processes are working and that they seem to be more responsive, and that they seem happier with them.
Thank you, we appreciate that. The staff has been working really hard.
Yep, and it's showing, so thank you.
Any other questions? Okay, thank you. Next is Jessica McKnight, Health Department Administrator, and you have 2 items for action. 4D1A is request approval of emergency appropriation ordinance amending the McLean County budget fiscal year 2024 combined annual appropriation and budget ordinance for Fund 112. Is there a motion? Motion by Hanson, second by Johnston.
So this is an item that was in our approved 2023 budget, so security cameras for the facility. And just due to timing and the RFP, it's going into 2024. So this amendment is just moving that money into this year's budget for that project.
Any questions? Hearing none, then we'll be voting on the appropriation ordinance for 112. All in favor? Any opposed? Okay. Next item is 4D1B, request approval and emergency appropriation ordinance amending the McLean County fiscal year 2024 combined annual appropriation and budget ordinance. I have a motion. Motion by Byrne, second by Hanson.
So this is through our Strengthening Illinois Public Health Administration, or SIPA grant that we got through IDPH, Illinois Department of Public Health, focusing on public health workforce and workforce development. We are seeking to give retention bonuses to public health nurse positions. As noted in my memo, when we did an assessment of positions that have been difficult for us to fill or retain, public health nurses have been that, and they're very vital to our workforce. So I'll be happy to answer any questions.
Is this for 112 or 107?
It's 107.
107, okay.
Yep, part of the
Didn't
grant.
have it on the agenda as to which one, and, but this one has 112, and this says 107. Okay. That's why I asked that question. Okay. Any other questions? All right, we will be voting on the budget amendment for Fund 107. All in favor? Aye. Any opposed? Okay. And then you have your couple of different things you want to present for information.
I believe, so for information, you have the proposed and the Project Oz contract and budget that was approved Tuesday by Justice Committee. So this is part of the county's opioid settlement funds, and just one of the aspects that the health department is partnering with the county to do, focusing on prevention. So working through Project Oz for education programs in the schools to prevent use, and happy to answer any questions.
Any questions from the committee? Member Hanson.
In your briefing, in the report, you talk about how it's focusing on Bloomington Normal Schools and potentially expanding into rural communities. There was a note about making sure that there was enough of a need. What quantifies that number, would you say?
I could not quantify that number.
Okay.
But it is a multi-year settlement, so this would be just the start. And we would really look to data that is from the state level and local level to give us a better idea of where to expand the program.
Wonderful. Thank you.
Any other questions? I think they also will use Illinois Youth Survey, which they'll be taking shortly, I think, or this coming year, to also evaluate some of that to where they might expand. So. No other questions? All in favor? Any opposed? Did we already vote?
We're not voting on this.
Oh, that's an information item, sorry. And then you have your monthly report.
I do, and you have the end of year, so statistics and a report from the Maternal Child Health Division. So happy to answer any questions about what is in this report.
Any questions? Okay, thank you. Next up is Cassie Taylor, County Administrator.
Thank you, Madam Chair. I have no items to present for this committee tonight. Thank you.
Okay, moving on, other business and communication. Our next meeting is Thursday, March 7th. Anybody have anything else they'd like to add? We didn't get 9 minutes today, but now we are adjourned. Thank you.